Hello everybody. With the COVID pandemic sweeping across the globe, there has been a huge focus on wearing masks to avoid the transmission of COVID-19. Now, there are a lot of masks available in the market and there is a lot of confusion as to what is the role of a particular mask and how efficient a particular mask is. So through this video, I just wanted to show you the common masks that are available and what their role is, what their limitations are. So to start off, we'll start with the most common mask that is available, that is the cloth mask. These are masks that people have stitched at home or bought in shops, and they are very easily available, and people wash it and reuse it. Now, the problem with this mask is that the pore size of this mask is between 80 to 500 microns, whereas the COVID particle is approximately 90 to 160 nanometer in size. So there is really a huge gap between the size of the particle that you're planning to stop and the pore size of the mask. Then are these masks useful? To some extent, yes, because they will stop the larger particles of saliva and larger aerosol particles, and they will reduce the velocity of the particles that come out of the mouth so that the radius of spread is a little less. Apart from that, not much of use, because when you tie these masks, they don't have any nose clip, they don't have any kind of elastic material, and a lot of times these are very loosely tied, so the gaps on the sides around your nose, they make for free passage of air all around. So not a very useful mask, but if you cannot find anything else, probably better than nothing. This is the second type of mask which is very commonly available, and vendors are making a killing by selling them at very high prices. These are called three-ply masks, but in India most of the masks that are available like these kind of masks are not three-ply. Three-ply has 3 layers. This mask has a very thin layer on this side and on this side. If you tear this, you will find that there is nothing inside. There's no layer in between, filter layer in between. This kind of mask is slightly better than the cloth mask that I showed you before. However, even their filter efficiency is nothing great, and most of the masks that are available in the market right now, they don't have a wire in the nose side, or rather a grip which can give you a tight fit, and a lot of them are quite loose and not properly fitted. So these masks are also of very limited use in limiting the spread of COVID. The next mask, this is a good quality 3-ply mask. It has 3 layers. This is the outer layer, this is the inner layer, and in between there is another layer which is quite effective in filtering particles. This mask also has this kind of a wire inside, so it retains the shape. If you look at this, if I put it around my face and then press it around my nose, this will retain the shape and cause a decent amount of sealing to prevent air from escaping from the sides of the nose. These masks are better than the previous 2 masks, and they would limit the spread of the infection outside. However, they are not very good at saving you, or rather protecting you, if there is a contaminated environment, because these do not have very great filter efficiency. Now, these kind of masks are also available. The most common company is 3M, but Venus and other companies, Magnus, they are also available in the market. They have a nose clip with which you can fit it nicely. They have elastic bands to hold the mask in place, and they offer a reasonably decent seal. Now, in these kind of masks, what you should be looking at is what is the rating. So N95 is a very generic term that is used basically for measuring dust protection and not exactly virus or any biological particles. So look at the FFP rating, whether it is FFP 1, 2 or 3. The ideally recommended FFP rating is FFP 3, but even FFP2 gives you almost a 94% protection. FFP1, most of the masks available in the market, such kind of masks are FFP1, they give you less than 80% protection. Now this particular mask that I am showing you has a valve which allows the expired air, that is the air that is breathed out, to exit easily. Now these kind of masks are They are good for preventing the particles from coming in, but if somebody is wearing it and is exhaling, his breath with the infected particles is going to come out through these. So they are not very safe masks to use. This is again an N95 FFP1 mask. This is the Venus 44 Plus. This is FFP1. Remember, again, this has the nasal clip, metal clip, with which you can get a very decent seal, and this does not have a expiratory valve, so even the air that is breathed out by the person wearing the mask is filtered. So these are fairly safe. Now, for a person who is not working in a hospital or is not going to high risk crowded areas, this mask is a fairly decent answer, in the sense that it gives you almost 80% protection against the particles of COVID that may be transmitted through the air. But for hospitals and for other high risk areas like pharmacies, markets, or anywhere where there is a crowd, these are not the ideal answers. This mask again is a N95 mask. Now this particular mask does not write, there's no notation on the mask whether it is a FFP1 or 2. We did some research. Some of the models are FFP2, some of the models are FFP1. So please do your research and find out what kind of respiratory protection are you being offered. Okay, and make sure when you use these masks, there are ways to tighten these masks. Your lower strap and your upper strap, once you put on the mask, should be tightened so that there is a good seal around your face and there's no area where air is leaking from. You can feel the small jet of air leaking from the side of your nose if the nose clip is not properly applied. Make sure that the seal is good. Next come the certified N95 FFP2 masks. So what we found in the market, the ones that were available to us were the 3M8210 and the 3M1860 masks. Now both of them are FFP2 masks. They have a very good protection. These elastic bands give you a very tight, very snug fit, and there is a good I would say cushion here, gives you a perfect fit around the nose without any leakage of air. So these masks are very good for people working in hospitals or in pharmacies or in other high risk areas, in closed environments where there are a lot of people coming in and going. These give you up to 95% protection. Now the only difference between this 8210 and 1860 is the waterproofing or the splash protection. 1860 is resistant to splash, whereas 8210 isn't. So those surgeons, especially those who want to wear it into OT where there is a risk of a direct aerosol or fluid jet to the face, they should not be wearing this. They should be wearing the 1860 mask. But for outside OPD purpose where you do not expect this kind of a fluid splash, this is good enough. So the next category is the big boss. These are the FFP3N99 masks, N99P100. These are called the half face respirators, where these are fitted onto the face with the harness, and they have interchangeable filters. These filters last quite long, and there are different ratings of filters. So 2091 and 2097 3M are currently what most of us are using, because number one, that's what we are getting, and they give you a N99 kind of protection. So if you are going to work in a closed environment, then this is the mask to use, especially if you think that in a healthcare setup you can be exposed to the virus. This mask has an expiratory valve here. They have a little less effort of breathing than the mask I showed you previously, and that is because there is a larger area for the air intake and an expiratory valve, so it reduces the effort of breathing. Now this is good for use by doctors or by lab workers or people in COVID centers who are doing COVID testing. This is a very safe mask. The previous one which I showed you was the 6200 model of 3M face piece respirator. This is the 7502. This is what I currently use because the filters are the same, the filtration efficiency is the same, everything is the same, except that here the expiratory valve is not in the front, it is below. So as a surgeon, when I am operating, I do not want my breath with an infected particle to fall on my surgical field, so I do not want the expiratory valve here. I have it here. But even those people who have the expiratory valve here, no problem, you can just cover it with tape, or what we do is that earlier what we did was that we put a piece of a plastic to direct the air sideways rather than directly onto the surgical field. So these are the masks that we are currently using, especially in our OTs. They do not obstruct your view. For ophthalmologists, when your instrument is coming in front of your eye, for example a slit lamp or a microscope or an indirect ophthalmoscope, these masks are still good enough to use. Two additional things that I would highlight when you are using masks is, one, for those who want to wear mask for a long time, do not keep removing the mask and putting it back on again, slipping it onto your neck and then putting it back on, and do not keep touching the mask, because the mask outer surface is among the most contaminated surfaces, and if you keep on removing the mask and putting it on again, you are increasing your risk of infection manifold. The second thing is, for those of us in healthcare or in any other job where you need to wear the mask continuously for 6 to 8 hours or maybe even longer, I had a small suggestion. What we are using is routine mouthwash, the dental hygiene mouthwash, before we put on the mask, because when you wear the mask continuously for 6 to 8 hours and you are breathing out into the mask continuously, there is a lot of chance of oral pathogens coating the inner surface of the mask and over time growing and multiplying in that area. So it's just a common sense thing to do, that you reduce the oral flora to the extent possible before you put on the mask. Some of the other masks, like the Chinese KN95 ones that we tried, they had some holes in stitching, some of them were not fitting very well. So currently we don't use them, we don't recommend them, because if there is any breach in the filtration, even the smallest breach, then it's almost as good as wearing nothing at all. Please see this video, use your masks judiciously, and decide upon which kind of a work environment you are or what kind of your exposure is, and then decide on the best quality of mask that you would like to use. Thank you.